Hi, I'm Dr. Huffman with Mounds View Chiropractic. I'm a board-certified chiropractic neurologist, and I'm a Diplomate of the American Board of Anti-Aging Health Practitioners. I'm also a certified functional medicine practitioner through Functional Medicine University. Today I want to be talking about how we work with patients that are dealing with acute pain, people that have disc injuries, that have spinal stenosis, and are experiencing nerve pain coming down their arms, coming down their legs, and have not been able to find answers. Some of these patients may have had surgery, some of these patients may have been told they need to have surgery, and some of these patients may be told they're not a candidate for surgery. And so how do we work with patients to find relief from these symptoms in a more natural way? The way that I look at patients that have acute disc issues or acute spinal pain, nerve pain, is really a couple of key areas we want to dig into. Number one, we do have to evaluate the health of the joint, the structure, and you can obviously use imaging, MRIs, x-rays to get an idea of the health and the integrity of the actual joint itself. But in addition to that, we also want to look for points of inflammation in the muscles that surround the joint. We want to look for old scar tissue from old injuries that can be impacting and creating more inflammation around that joint. So we do a full musculoskeletal evaluation where we actually are going to test the joints. We're also going to palpate through the muscles and find out any scar tissue that's in there. And then we do a full nerve evaluation where we actually test the nerves as they come out of the spine. And we trace them all the way down the arms or down the legs and find out if there's any nerve compromise. There are different types of nerve fibers that travel in different parts of the spinal cord. And so evaluating and finding what types of nerve fibers are being impacted can give clues about where the actual impingement or irritation is occurring due to the spinal lesion as well. And so we do a full nerve evaluation with all of our patients as well. In addition to looking at the spine, the nerves, we also do a brain-based evaluation. And why would we do that? Well, a couple of reasons. Number one is that when you feel pain in the brain. When you perceive any type of pain, it is the brain that's telling you have pain. And the brain can wind up that pain. So the longer you're experiencing this pain, the more sensitized the brain becomes to continuing to perceive pain. And so we want to take a look and see how is the brain doing, and are there areas in the brain that we can work on to calm down the sympathetic nervous system that heightens the pain response. Because if we can do that, it can have a positive impact on the pain you're perceiving as well. Now, in addition to looking at the brain from a pain-based model, we also want to look at the brain from a standpoint of how is it doing regulating the structure and maintaining the postural integrity of the spine. In your cerebellum, you have the vestibular nuclei, which the vestibular nuclei fires down and controls spinal postural muscles. And so we look at the integrity of that vestibular system as a whole to find out, is your brain doing a good job stabilizing your joints in your spine? This is one common area that I see problems in for patients that have tried to be adjusted, but they find that they get adjusted and it doesn't hold. They just have to keep getting adjusted over and over again, and it keeps being the same problem over and over again. One common player I see in that is that if the vestibular system and the cerebellum are not doing their job correctly, you just have less stability there. So doing things that strengthen the cerebellum can help actually improve that postural integrity and help take pressure off of dysfunctional joints. One other factor that I like to look at with patients when we're working with patients that are in these types of acute pain syndromes is I do like to look at things going on inside the body that we can use to help reduce inflammation. And so if there are any lifestyle factors that are promoting more inflammation for a patient, it's going to make the pain worse. And so if a patient's diabetic, if a patient has some sort of gut issue, if the patient is eating a really highly inflammatory diet, these are things that are going to impact pain levels. And so we always evaluate this with all of our patients as well and work to support the patients from a nutritional standpoint, from a dietary standpoint. We can run lab testing to help decrease inflammation from a metabolic point of view as well. And when we bring all these pieces together, we have really great success. In addition to working with patients from those different angles, we use some of the best technology in our office to help patients that are in these have this type of acute pain. One thing we use is what's called non-surgical spinal decompression. Spinal decompression is a technology that allows us to very slowly traction disc spaces and try to take pressure off of the muscle and off the joint. And this allows for healing to occur. And so we use decompression with any patients that have any type of compressive issues in the neck or in the low back as well. We also use what's called the M6 laser therapy. The M6 laser is a robotic laser. It actually has 4 class 4 lasers in it. And these class 4 lasers use laser light to actually stimulate and support healing in the joints and trying to reduce inflammation around the joint capsule. The more powerful the laser, typically the deeper the penetration. And that's why with these disc issues, we use the M6 laser, because it is very deep penetrating. We also use what's called pulsed cellular stimulation, which is a form of electrotherapy that, again, we can put stimulation through an entire joint area. You can actually feel the stimulation going in the back of the low back and coming out the front. So it's a really powerful form of stimulation that has also been really helpful for me with patients that are dealing with a lot of severely acute cases. So we use some great technology to help with these issues. We use what's called horizontal stimulation that can actually work to fire nerves that are irritated and try to help reduce nerve pain that's associated with these disc issues. And so these are all just different strategies that are potentially applications we can use to help a patient that's suffering with this severe acute pain. So I hope this gives you a little bit of insight into some of the strategies we use in our office to help patients that are in acute pain. If you or somebody you care about is suffering and is having a really hard time and not finding answers or solutions that they're comfortable with for any type of nerve pain, back pain, neck pain, we would love to be able to talk with them and help answer any questions and see if the care that we offer is something that might be of benefit for them. We offer a free phone consultation for anybody that sees these videos. So all they have to do is just register online or call our office directly at 763-398-7770. And we can set up a free phone consultation where I can discuss the specifics of that individual's case with them and see if they would be a good candidate for our care. And from there, we can set up an exam where we dig into this and take a look at what we can do. So I hope this helps. I hope it gives you some hope. And if you are suffering, please reach out to our office. We'd love to help you out. Thanks so much and have a great day.